So, good morning to some and good afternoon to many of you. Thank you so much for joining us this afternoon. We will begin shortly. In the meantime, please introduce yourself in the chat by sharing your name and where you are joining us from. I am Shanta Chambers from the Self Made Health Network, and I am so excited to welcome you to the first installment of our webinar series, Advocating for Policy Change to Support HPV Vaccination, hosted by the Tri-Network Cancer Prevention Community of Practice. Next slide. Before we dive in, let's go over a few important details today. All participants are muted by default, so please use the chat box for general comments. If time permits, we will have a dedicated Q&A session at the end of the presentation. If you have any specific questions for the presenter, please use the Q&A box. Again, for any questions for the presenter, please use the Q&A box. Following this session, you'll receive a post-webinar email containing the recording, slides, and an evaluation survey. Your feedback is invaluable to us, so we kindly ask that you complete the survey. We can't stress enough how important your feedback is to us for our continued webinar series and all future offerings. Again, thank you for joining us today. Next slide. Next slide. The Tri-Network Cancer Prevention Community of Practice is a collaborative effort between three CDC-funded national networks: the Geographic Health Equity Alliance, Nutravoces Adelante Network, and Self-Made Health Network. Our goal with the Tri-CCOP, which I refer to it for the future, is to enhance the capabilities of national comprehensive cancer control programs, cancer coalitions, and allied partners in implementing policy, systems, and environmental change strategies that target the root causes of health disparities leading to increased cancer rates. The Tri-CCOP aims to bolster interventions that address the needs of underserved populations, including those with low socioeconomic status, Hispanic Latino communities, and geographically defined groups. Our focus areas revolve around four priority topics: HPV vaccination for cancer prevention, improving the built environment and physical activity, ensuring food and nutritional security, and expanding access to broadband. Throughout the Tri-Network Cancer Prevention Community of Practice, participants will gain a comprehensive understanding of evidence-based policy systems and environmental strategies pertaining to these areas. Learn about policy systems and environmental change processes, and develop the skills necessary to apply this knowledge within their own cancer coalitions. Moreover, all participants will have the opportunity to align their work plans with sustainable policy systems and environmental change objectives, and use essential tools like stakeholder mapping and issue briefs in their efforts. Next slide. So I want to draw your attention to the actual application for the Tri-Network COP. So it is an 18-month commitment. I know that sounds like a lot, but look, we're almost through February, so time is moving really quickly. This community of practice is open to all state cancer programs, including the District of Columbia, Puerto Rico, the U.S. Virgin Islands, as well as tribes and tribal organizations. The application deadline is March 7, 2024. You can find a link directly to this application in the chat. And I encourage all of you today to really reach out and coordinate and work with your National Comprehensive Cancer Program. And please join us by submitting an application for this Tribe Network Cancer Prevention COP. Next slide. Again, apply online. It's easy. It doesn't take a long time to do your application. And as I just mentioned, as you can see, we have a well thought out curriculum plan for this cancer prevention COP and really encourage each of you to join us. Next slide. And now, the moment that we've all been waiting for, an opportunity to hear from our presenter. Dr. Whitney Zahn is an assistant professor at the University of Iowa's Department of Health Management and Policy and is a full member of the Holden Comprehensive Cancer Center. Her research employs health service research, social epidemiological, and spatial methods to address rural cancer disparities across the cancer continuum and to evaluate access to healthcare services. She has a specific interest in reducing cancer disparities among rural minority population. She leads the university's Advancing Cancer and Rural Equity Lab. Dr. Zahn also serves on the board of the Iowa Rural Health Association and co-chairs the Cancer Prevention and Control Research Network Rural Cancer Work Group. Give me a virtual applause as we bring to our screen this afternoon or this morning, Dr. Zahn. The floor is yours.
Thank you very much, Shanta, for that introduction. And it's great to meet all of you and see your affiliations in the chat and to hear a little bit more about your this great tri-network effort. And so great to hear about that. I'm going to share my screen here and talk a little bit today about HPV vaccination and how we can advocate for policy change around that area. Are you all seeing the presenter view or the notes view?
We're seeing the notes view.
Oh, the notes view, okay. Okay, I'll go ahead and go forward and let me know if anything technically is having any issues. Great, but again, great to be here. Looking forward to share some thoughts and hopefully some helpful strategies for advocating for policy change in HPV vaccination today. So kind of the key objectives that I hope to get across today and have some present some strategies around or first identifying partners and policy levers for HPV vaccination, and then present some different types of data that can help enable coalitions and others to advocate for a policy change. But I think it's important to kind of set the stage with those potential partners in ways that we can advocate at different levels to address those. So go forward here. So where are we? I just want to start by just kind of putting into context the discussion. And we know, and I'll share a little bit in the data portion on the increase in HPV-associated cancers that are on the rise throughout the country. But we also know there's more and more research affirming what we had anticipated, that HPV vaccinations are effective. I know recently, in the last couple of weeks, there was a big research article that was published that really affirmed that showing that there's this cohort of individuals who had the HPV vaccine, and it's been long enough since we've started, having those vaccines available early enough for those adolescents where we're seeing a really big drop in cervical cancer. I also want to put into context too, as we're all aware, working in public health and healthcare and in the different areas that we're working at, we're in a unique position when we think about policy change in the midst of kind of our post-pandemic environment. I used both because both peri-pandemic and post-pandemic, because we know we're in this unique spot where there some misinformation, some policies that are put forth that kind of push against vaccines in general. And so anything that we talk about will need to be considerate of that unique position that we are in. So I want to orient us around some things, and you all are likely very familiar with these, but just to ensure everybody's on the same plane here. I want to talk about the idea of when we think about policies, there's several ways to think about this. One is in the little p sense, in the sense of, can we make policy change within our organizations, guidelines within agencies in different ways. And these are going to be enacted at a different level than the big P policies that are more formal in nature, may need to be passed by local governing agencies, states, federal agencies, etc. And both of these are going to be important for policy change, and they're going to, there are different ways that we can leverage those. So as I alluded to in thinking about some of the policy recommendations that might be available, that we're in a unique current challenge where there's misinformation about vaccines more broadly. When we think about COVID, even, we're seeing measles outbreaks becoming more and more common, in part because of some misinformation. And we're also seeing increasing efforts to roll back current laws, regulations, rules that are related to vaccines and those kinds of things. So just to give some examples from where I'm sitting here in the state of Iowa, last year we had a law that passed that was to remove the requirement of teaching about the availability of the HPV vaccine in kind of health education settings. That did not preclude school districts, health teachers from talking about the HPV vaccine, but it removed that requirement part. So we see that as something that's happening. In our current legislative session, there's some bills under consideration that would disallow minors from receiving care for sexually transmitted disease or infection, and that includes prevention of those, such as the HPV vaccine. So I should say, I'm sorry, without parental consent. It's not that they couldn't get it, but it was that it removes that that ability for adolescents to or minors to get an HPV vaccine without consent of their parents. So I'm just bringing those up as examples of our current challenge. And if we talk about different policies, just these are the things we need to consider. So we're also therefore kind of in a place where preventing policies that may have a negative impact on HPV vaccination uptake might be just as important as promoting bills or policies that we anticipate would have a positive impact. So I want to put that into our context as well. So I'm sharing this as a rural example from a paper that several individuals published a couple years ago. Recognize this says rural, but this is really applicable to urban, to suburban, to any settings. We're just thinking about what are the different, getting back to that little and big P policy, as well as the different levels that we can think about policy opportunities that we can advocate for. Here's a variety of those at multiple levels. So we see at the top, there's a lot that are more in those little P settings within clinics, provider recommendations, standing orders, participation in the Vaccine for Children program, as well as a variety of other settings, thinking about alternative settings. Again, going back to the impact of the pandemic, it's not just thinking about it, not just in the negative sense of, okay, we're seeing this greater vaccine misinformation and hesitancy, but also leveraging some of the silver linings that came from the pandemic, like the role that pharmacies can play in providing vaccines. So that's an example here. So this kind of gives a menu of potential options, thinking about what can be advocated for, whether that is within your own individual organization or providing, at a coalition level, helping provide support for your members of your coalition or others to implement some of those changes in the little p policy sense, as well as some others around that are going to be more national or state in nature around, say, immunization registries, school entry requirements, and research. I also want to draw your attention to, and this is linked in below, and when I share, I'll be sure to share the slides and get that to all of you so you have those hyperlinks. In the last couple of years, the St. Jude Comprehensive Cancer Center has established HPV cancer prevention program. So thinking about the fact this is, an organization really focused on children and adolescent cancers, but that's also hitting then what can we do in childhood and adolescence to prevent cancers developing amongst adults. So they have provided, a document of examples of policy recommendations that I'll share here, that also kind of wrap up with some examples of bringing that forward. So you can see here there's some around leveraging current vaccination models when it comes to education and recommendation as a model, expanding healthcare provider practice and staff education related to the vaccine, strengthen those recommendations for parents and caregivers, kind of pulling from that previous slide, improve efforts to recruit and enroll different types of healthcare providers and federal vaccine for children programs, because I think there's some unique opportunities there to make that freely available to those who are eligible for vaccine for children programming by expanding and diversifying the settings in which individuals can get HPV vaccines or a variety of other childhood adolescent vaccines. Others is expanding the resources available for data collection and reporting through state immunization information systems. That can be a really important element to see how things are going beyond, survey data collection, and leveraging those systems to help kind of get the lay of the land. There's a lot of variation in what states require or have, or how they make that data available to others as well. And another element is just engaging efforts to preserve and expand eligibility for Medicaid, just as some examples that are provided by St. Jude, recognizing that a lot of children are covered under Medicaid, and thinking about those who are recommended for and eligible for HPV vaccines, that's an opportunity to make sure that that is covered, in addition to things like the Vaccine for Children program that provides another avenue for ensuring that folks have access to vaccines without cost burden. So we might think about, kind of transitioning to the data element and what's available. It's helpful to think about, what is the challenge we have in the policy space around HPV vaccination. And I think when we think about policy specifically, it's it's important to kind of get the lay of the land with regards to individual states or multi-states and how we can leverage those. There are some resources I have linked here on, what is the policy landscape, whether it's HPV vaccine mandates, which is in limited number of states, that is one avenue, but there's a lot of others that maybe more politically palatable, linked here to think about, kind of also tying back to the St. Jude recommendations around Medicaid coverage, but also thinking about not just for children and adolescents, but also for those who are on the older end of being able to a recommended age for HPV vaccines. The Kaiser Family Foundation tracks state-specific Medicaid coverage for vaccines amongst those older than 21. So that can help us get a sense of, what are some areas where there can be policy change to ensure folks are covered. And there's also some other tools available that I think are really helpful at kind of doing policy surveillance, legal epidemiology, around a variety of health-related topics. I don't believe any of these have anything currently around HPV specific or vaccine specific, but they're ones I think are really good resources just in general to keep an eye out for in case they do ultimately add more with that. This first one here is the National Council on State Legislatures. They provide a lot of resources. And they also, I was at a conference last week, the National Rural Health Association's Policy Institute, and they had a person from NCSL there presenting. So they have someone who's really focused in the health space as well that could be able to help with your coalitions, programs, others to kind of help provide information that might be of interest when we think about the state policy landscape when it comes to HPV vaccination. National Association of State Health Policies also does some tracking, as well as Temple University has a law atlas that's very health focused. So those are some resources when we think about what is our current policy landscape in our individual states that might be helpful then to think about what is potential avenues for advocacy in that sense. When we think about data sources, I think one of the key things can be really helpful for us is thinking about, demonstrating the challenge we're facing with HPV associated cancer incidents. So I'll talk a little more specifically what that looks like, but your state cancer registries are good resources. They may be able to provide you just directly with data to analyze or be able to produce some of these statistics. There's also the CDC public use data set, which has built within it an HPV-associated cancer ability for you to calculate that. So if you want to break it down within your state by rural urban status, race, ethnicity, age, other factors, you're able to access that through SEERStat. So that's just another avenue, or if you want to maybe do some comparisons between your state and another to, if that's a strategy you want to undertake. But in any event, that's a way to demonstrate that. I'm going to show some of that. Again, I know I'm showing the rural urban, but this is a way to think about it. Again, you can look at it in different ways within a state. This is national data, but I do want to show some of this where, just as an example, the types of data, you can break this down by individual HPV-associated cancer types and share that. And I think that can be powerful as I talk more also about trends. So some students and I have some work that's under review where we're looking at rural urban differences in cancer, and one of those being HPV-associated cancers. And I just share this again, just as more of an example, but the key thing is, regardless of where you live, HPV-associated cancer rates are increasing and have increased between 11.6% in more urban or metro areas between 2001 and 2019, and over 28% in rural areas during that time frame. So we're seeing this increase in HPV-associated cancers, but we're also seeing, going a little different order, we're also seeing, though, a general decrease in cervical cancer rates over time. So there's a little bit different dynamic than what we typically see. Is obviously HPV, as I showed in a previous slide, cervical cancer is the leading cause of HPV-associated cancer, but we see that's improving over time, whereas oral cancer, for example, has increased quite a bit, especially in non-metro areas. Now, putting this in perspective, this is, a relatively rare cancer overall, but we're still seeing those big increases. And, here in Iowa, that has been this discussion has been a real leverage point for cancer-related policies at the state level, because our oral cancer rate is the highest in the U.S. here in Iowa. So I think thinking about how that's broken down and how you can use that data to share with others to help make that case for the need for policy changes at a variety of levels, that can be helpful to kind of break that down, because it's not, in recognizing this is not something that's solely affecting women, it's affecting all people. I noted earlier the state immunization registries. There's also other sources of data that can help us get a sense of HPV vaccination coverage. See here from the CDC Teen Vax View, we're able to look at that in a variety of different ways. Again, breaking it down by rurality, by race, ethnicity, by other characteristics. And I have a couple of examples here of what that looks like, whether that's looking at differences by geography within a state, and that breaking down here, or looking at trends over time, looking at your state compared to other states. And so you're able to break that down, and that can help kind of demonstrate where your state is. And this is from the NIS Teens Survey, which has a survey component, but where you're asking parents, but that's also that data is supplemented by data from physicians, the pediatrician or whomever as well. There's also the behavioral risk factor surveillance system module. There's an optional module states can use to look at the number of adults who've had an HPV vaccination. There's some caveats to that, as far as what the full picture that question can give, because of when HPV vaccination started to be recommended and other kinds of caveats, but just want to make you aware of that option as well. I think another thing that's really important to think about is understanding where we're at when it comes to knowledge and recommendations. There are data sets and briefs available from National Cancer Institute's Health Information National Trends Survey. Within that, there are not state level estimates available if you're looking at state level coalitions, but I think it's important you can still get a sense of, okay, this gives us an idea of where we're at. And we're actually seeing, with some of the data that's been analyzed in recent years, that there's a decrease in the awareness that HPV causes cervical cancer, for example. So there's some, I think, important pieces of information that can be drawn from that to really set the stage for, why there is a need for, policy change, whether that's education related, whether that's in a clinical setting, whatever it may be. Some other ways is just the idea of, we can use cancer surveillance data, we can use survey data, but oftentimes going to be most effective is that local data and those stories. I think the balance of data and stories is really impactful. And so I think, it can be engaging groups and hearing their perspectives, whether, it can be engaging cancer survivors who can speak to, cervical cancer survivors often speak to this, and, maybe that HPV vaccine wasn't available early enough to have prevented it for them, but there's really that opportunity. A lot of different other kinds of qualitative approaches as well, and just exploring knowledge, awareness, clinical practice, educational practices. I'll give an example here in a little bit through some small scale surveys that I had the chance to be involved in, just to kind of get the lay of the land. Maybe it's thinking about, and I'll talk about a pharmacy specific example, recognizing that's, as I noted, as a policy lever, that's maybe a unique opportunity for us to leverage that, depending on, obviously, workforce challenges we're facing in healthcare broadly. But that's just an important way to think about it. So here's the example here. So I was previously at the University of South Carolina, and right as the pandemic was hitting, we were launching a HPV vaccination survey of pharmacists within the state of South Carolina regarding HPV vaccination. And this kind of highlights some of the things that we identified or they shared with us through those surveys. And again, this survey was done right when the pandemic hit, prior to COVID vaccines being available, but still obviously a unique, challenging time healthcare wise. But they identified some of the barriers that folks are experiencing at the patient level, organizational, environmental factors, maybe some of the benefits and facilitators of, utilizing pharmacists for HPV vaccination that we see here. And this is, kind of an excerpt of our poster at the American Public Health Association conference on that. So that can be an avenue to assess, partnering with, maybe it's your state pharmacy association, or maybe, if you're thinking about the pediatric angle, your state Academy of Pediatrics chapter, family medicine chapter, whatever it may be, your primary care association, if you're thinking about federally qualified health centers and other settings. Most states have a association of rural health clinics. That can be another important avenue. So I think collecting that data, or having those conversations, whether that is a more formal survey, whether that's just, small 20-minute Zoom chats, whatever it may be, that can be helpful. And I just want to share some examples of then taking some of that data and using that for advocating for policy changes. So when I was in South Carolina, I was part of our state Cancer Coalition, had an HPV vaccination focused work group. That's an avenue to, within your coalitions, whether you're HPV specific or if you're more broadly, that's an avenue to create those work groups and then grow to address those things. But we put together some information at the different districts, House districts or Senate districts. I think we made a kind of one pager for both of, how many pharmacies are in your district, and sharing that is like, is there an opportunity to broaden the scope of practice around vaccinations? Again, this was pre-pandemic, but that's, a way we could show that data to others. And then there's another one we made more on the Vaccine for Children programming side. I know it's a little blurry, but we showed where those locations were throughout the state of South Carolina. We also have that broken down, again, rural urban, but showing where there's a difference in the types of providers, VFC providers across rural and urban. And that gave us an idea of, are there new opportunities to make those connections with regards to advocating for new VFC providers in new locations. So we saw, for example, there was a lot more the highest percentage of rural located VFC providers were in federally qualified health centers or, community-based clinics. We saw in urban areas, it was more common in private clinics. And we saw in rural areas a little bit higher. This is second set of bars in local health departments. So that's all. Maybe there's an opportunity in urban areas to connect with those local health departments to provide, to be part of the Vaccine for Children program. I note here too, this is from our one of our immunization coalitions here in Iowa, some one of their briefs and visualizations, just highlighting again what I noted earlier around Iowa being the highest rated oral cavity and pharynx cancer rate in the country, and noting, this is, many of these are due to HPV, and then showing some other pieces of information that could be shared, and some brief calls to action here. So there's different kinds of information that can be shared and to advocate for policy change, whether it's more data focused, whether it's more, here are some calls to action, or some element in between. These are ways to I think very tangibly and succinctly be able to share that with legislators, with others who might be advocating for certain policies as well. So I want to talk about this idea of partnerships and thinking about how we can advocate for policy change. And all of you working in coalitions and working with comprehensive cancer control programs, all these different settings. I mean, this is what you guys do every day. So I know I'm in many ways just kind of preaching to the choir a little bit, but just want to highlight different things, different opportunities around partnerships, and give an example of one partnership around vaccines that um, that I think was particularly effective in a policy space in a different way. So obviously, leveraging existing partnerships can be really effective. Everybody's very busy and maybe doesn't need, one more meeting to go to, or one more, it's a way to leverage those. Is there a way to tap into those that are relevant, even if, maybe not slightly tangential, but there's an opportunity there. Going across sectors, multi-level kinds of partnerships, whether that's, local, state, national, whatever it may be, and finding intersections between those different kinds of coalitions. I think that's especially true for something like HPV, where we know there's a lot of cancer coalitions. States often have their own, and as well as immunization coalitions. This is an opportunity to find those intersections. Or, as I noted earlier, maybe it's the Cancer Coalition and the state chapter of Academy of Pediatrics, or Primary Care Association, or whatever. And then connecting with nationwide resources. I linked previously St. Jude's. There's a lot of others, and St. Jude has other resources that are available there, as well as some webinars that they've done recently on HPV, and a lot of other resources, HPV Roundtable, and that can be those all can be pretty effective as well. So I want to give an example of partnering on vaccine initiatives. This was not specifically around HPV, but I think it proves to be a potential consideration for, thinking about where you're situated, your community, your state. Are there similar things that you could consider for different initiatives? And so this is some previous work that I had the chance to be involved with when I was in Illinois, in Springfield, Illinois, and working for the Southern Illinois University School of Medicine, part of the Springfield Collaborative for Active Child Health. So this was a academic community partnership that included the medical school, the Springfield School District, the Urban League, which housed the Head Start program in Springfield, the state public health department, and the local YMCA. And this was really focused on nutrition and physical activity in elementary schools and Head Start settings. And we had some funding from Blue Cross Blue Shield. But as part of that discussion from that academic community partnership, one of the things that was coming up, especially with the school district, is that with the school district policies were as such that, in many states, not all, there's some level of requirement around having vaccines to go to school, or having, different times throughout their education, ensuring they have a physical prior to starting the school year. With the school district policies, if students did not have that done by a certain time in the school year in the fall semester, they were excluded from school until they addressed that. And so drawing from that collaborative effort, that partnership around active child health, kind of a separate coalition was developed that drew in specifically the Sangamon County Health Department, as well as the medical school and the school district, to address that, lack of requirement, not meeting that requirement around physicals and required immunization. So again, that wasn't HPV related, but that it still has that vaccine component that I think is very relevant here. So setting the stage there is one of the things that this coalition was able to do was, one, provide a series of clinics during registration or right before the school year started. I think a couple of these were registration based. One was at like a free backpack giveaway, where they also had clinics, were able to do physicals and immunizations on the site, as well as the public health department having a clinic. And you can see that here on the right. But also, I guess, thinking more in the policy sense, is recognizing this challenge that the school district was facing with students being excluded, and then also had economic impact on the district, because I think there's certain funding tied to, you know, every day a student is in school as well. So the coalition really advocated more at a school district level. Again, this is getting at the different levels, small p policy here, to move that medical exclusion date up a little bit in the semester, to really kind of be a, let me say a disincentive, but it kind of really make a difference where people were making sure their kids received those immunizations and physicals earlier, and then we're not out of school as long. So they did find that between comparing school years from when that policy went into effect, there was a lot fewer school students who were excluded for those reasons, because they had that change in policy. And they weren't, you know, they were up to date on their needed services, and they weren't unnecessarily missing school. So again, this is not an HPV specific vaccine policy change or coalition, but I think it's just emblematic of the kinds of creativity that coalitions can leverage around vaccines, and working together to make policy changes, advocate for those changes. And it doesn't necessarily have to always be at that state or national level. This is another way to do that. So just wanted to share that, and this is, you know, there's a little more in the paper that we wrote on that. So just, I guess, some key takeaways here is being cognizant, as we all know, of kind of the challenging policy environment we're in when it comes to vaccines, the importance of data and stories to advocate for change, and then leveraging those established partnerships and developing new ones to advocate for change. So that last example I shared is kind of emblematic of that, where there was that established partnership, but, you know, there was additional partners involved as part of that to advocate for that change. So with that, I am happy to take any questions. Should we have? Yeah, we have time. I'm happy to take any questions people may have, and also as well via email if people have questions in the future or later on. But thank you very much.
Thank you so much, Dr. Zahn, for your time today. And of course, this amazing presentation. It always simulates more and more questions around these opportunities before it's in the HPV vaccination space. One of the things that you pointed out in your presentation is now we're beginning to see this increase in oral cancers, right? Related to HPV. Can you talk a little bit about maybe some new partnerships or some new activities that you may see going on in states or specifically in Iowa to address this very specific type of cancer?
Yeah, that's a great question. You know, I think there's opportunities to thinking about oral cancer, and thinking also about, you know, I'm going to go back to, sorry, this is going fast. I'm going to give anybody a, thinking about alternative settings. So we see here HPV vaccine programs, schools, pharmacies, mobile clinics, and dental practices. So I think that is a really unique opportunity to think about, particularly around oral cancer, because dentists can also do a screening for oral cancer. But I think they also then have the opportunity to have, you know, that discussion. I know there's some early kind of feasibility and pilot studies that have been done around leveraging and connecting with dentists for education, or around HPV vaccination. I don't know, again, that's a scope of practice thing. Around vaccines, I don't know that they often give vaccine or can't, you know, have that, but I think that's an opportunity. I think, you know, we've had here in Iowa, we just released our state cancer registry just yesterday released our updated report on cancer that they do every year. And another I think this is not just true for Iowa, this is true for the country. There's an increase also in alcohol-associated cancers. And so that's another one where there's that's oral cancer is one of those. So I think, and I know they had one of our ear, nose, and throat or otolaryngologist who treats a lot of oral cancer as part of that kind of press conference around that. So I think, particularly with oral cancer, I mean, no cancer is pretty or a good experience, but I think oral cancer is one where the quality of life is particularly, with swallowing and eating and just, the surgery in the face that's required or the treatment, it's going to be different in how that manifests itself. So I think there's, really important, again, maybe sharing from survivors or others that there's an opportunity there, I think, too, with survivorship groups. That's true of any cancer, but I think, there's some other things in that space as well.
One of the other things that you pointed out in your presentation was really around the importance of partnership and the fact that your example also included non-traditional partners like the Urban League and the Y, et cetera, in this conversation around vaccination. When you think about one of the things you noted opening up your presentation, that there's still a high degree of vaccine hesitancy. Are you aware of examples of how entities have leveraged these partnerships or formed partnerships around messaging specifically to HPV vaccination?
Yeah, that's a great question. I'm sure there are some in the last couple of years that I can't speak to specific ones that jump out to me as far as different organizations. I know some of my colleagues here at the University of Iowa in our Community and Behavioral Health Department, in our Prevention Research Center, did some, I guess, getting again to the role of qualitative data or conversations, did some interviews to help inform messaging and education around the COVID vaccine. And that included a lot of imagery, patriotic imagery, for lack of a better term. And that was something that was effective maybe in making, making more hesitant populations, maybe more receptive. But they wanted to make sure that message resonated with those folks. As far as partnerships, I'm trying to think of some that I've heard of. Part of the St. Jude group that I mentioned, they have a think tank, and there's a lot of people that are involved in that. I'm trying to think of some of the partnerships that they have brought up. But I think, there's a lot of, any opportunity, I think, in the health space that you're partnering on, there's probably an opportunity there. I think, the school element, I think there's, opportunities there, recognizing that, I want to be very cognizant of political, of realities in that, but I think, there's opportunities with any of those that are tied to the health space. The Urban League was one with, they had they were leading the Head Start program in Springfield. But I think looking at, are there, similar kinds of organizations working with children that might, might be there. And I'm sorry, I'm just blanking on some of those maybe more specific, unique ones. But I think, a lot of those that we think about for any kind of cancer or health partnership, I think there's going to be some opportunities there.
Wonderful. And I'm actually going to open the floor. I have a question from the floor. Marcella?
Yes, thank you, Dr. Sam. That was a very interesting presentation. Can you talk about more? Can you talk more about the importance of qualitative data and how that can be also used for the, for the programs at the state level to advocate for vaccination?
Yeah, that's a great question. And I'm using qualitative maybe in the researchy sense, but I think, I can think, you can even think of it as just stories. I think those can be really powerful. I think any kind of situation where I've been in some kind of policy training, for lack of a term, advocacy, that is something they said, stories are, at least from a policymaker perspective, those are going to move them more than a bunch of bar charts sometimes. So I think you can think of qualitative data, maybe it's having, interviews with people who, whether it's who've had a HPV associated cancer or pediatricians or family members. I think HPV is unique in the sense of it being primary prevention, and whereas like screening, you can say, oh, I had screening and I caught this early, whereas HPV, like if you get the vaccine, you're likely never to get, it's not about detecting it early because you never, got the cancer. So I think the stories are going to be a little different than maybe for colorectal or breast cancer or some of those. But, I think when I say qualitative, I think it is those stories we hear from people, and maybe even qualitative in a broad sense, or in primary data sense, where it's not the registry data. Maybe it's surveys, or qualitative. It's not necessarily thinking more broadly than what I already mentioned, but talking to, identifying who is engaged in, for example, maybe getting, I guess I didn't have this in my slides and I think about it, but another source of quantitative data is the Vaccine for Children program, who might have that in your state. And so maybe having conversations with those who have that program, learning their, qualitatively learning, okay, here's what's worked for us in it as far as implementing the Vaccine for Children program in our clinic or our, pharmacy or our local health department. So you can share those experiences with a clinic that doesn't currently have that program and help them be able to implement that. So that's another, I think, example of qualitative data that kind of help inform that and it make that kind of little p policy change.
Thank you.
So Dr. Zahn, one of the other things you opened up with was really this conversation around little p and small p policy. Oftentimes, we have in our audience today representatives from National Comprehensive Cancer Programs, and oftentimes, historically, that P word has been a bad word. So in our current environment, when we think about our path forward, what are some recommendations in terms of the roles that you really see comp cancer programs being able to play in shepherding this transition and move towards this little p and big P policy?
Yeah, that's a great question. I think one of the key things I think about is, these programs developing their state comprehensive cancer control plans, and those have goals, objectives, strategies, tactics built within them. And I think, when you think about specific, across the cancer continuum, HPV vaccination being in that primary prevention element and recognizing kind of the environment we're in, I think it can be developing strategies that support organizations engaging in those little p policies. I think is one way to do that. So I could, just as an example, so some of these, I think these descriptions, kind of tweaking them and rewording them could be a start. Things like the VFC program, other things we see here around communication or provider recommendation, or training. It can be providing webinars for clinicians. Maybe it's tying it to a CME, a continuing medical education, other things where that's something that's highlighted. I think those are just a few examples there.
So potentially serving in that facilitator or convening role where
Yes.
you're kind of putting, it's almost kind of a call for all hands on deck, right? Really using these efforts to activate and mobilize others within our respective state where this topic may be important to you, but they may not be necessarily clear on how to engage.
Yeah. Yeah, I think that's probably going to be the most effective in this day and age, I guess, for lack of a way to put it. But and those changes can make a difference. And I guess thinking about programs specifically and that their key role of developing those plans, I think there's really that opportunity, and then that provides all these other organizations with that document to say, look, this is something the state has identified. Then we can move forward with that.
Thank you. And take a final question, Marcella.
Okay, yeah, Dr. San, also, can you talk about you talk about the challenges, the current challenges about misinformation and other issues that are affecting the vaccination rates and the rollback of legislations and regulations. Now, when we talk about HPV, that has always been quite challenging because the whole association with sex and individuals, especially parents, think that by vaccinating their kids are going to start having sex right away. So we always talked about how we can use the cancer issue, the cancer prevention.
Right.
So can maybe just you expand a little bit on that?
Yeah, that's a great question. And yeah, because I mean that's an understandable concern. And you're right, this is something that was from prior to the pandemic, where this is it's a different conversation than talking about measles or mumps or chicken pox or whatever it might be. I think that kind of ties into that first little P listed here around provider recommendation. And I think the way that can be presented in a pediatric adolescent visit where a physician can say, your child is, due for these vaccines that are related to preventing. I guess the phrasing that it is very much focused on that prevention of cancer. So I'm trying to think of specific phrasing that I've heard, but I think that's the opportunity there is really just as you already noted. I think the cancer prevention element and framing it in that sense, and framing it as part of the more holistic, this is recommended amongst a series of others as well. So it's kind of part of that package together, I guess. But I know that's still a challenge to how to frame that and in the way that's people are going to be receptive to, but are also just truly reflective of what the vaccine does as well.
Thank you.
Thank you. So as we conclude the webinar, we want to give a big thank you to you, Dr. Zhang, for your work and your insights. We also want to thank all of our attendees for participating today. What you heard and what you saw, much of what you heard today was just a really high-level overview of the type of content that will be addressed in detail as part of our Tri-Network Cancer Prevention Community of Practice. The training and TA provided through the COP will include both high-touch engagement around the priority areas, again, that include vaccines to reduce cancer, for example, HPV, as well as the built environment and physical activity, food and nutritional safety, and broadband access. To give you a primer to these priority areas, we have a series of webinars that have been scheduled. So we encourage you to take a look at these other webinar offerings. Also in the chat, what you do see is again a link to the application for our Tri-Network Cancer Community of Practice. So I encourage you to get with your Comp Cancer program, or if you are a Comp Cancer program, I encourage you to get with your Cancer Coalition and really consider applying for this year's Tri-Network Cancer Prevention Community of Practice. We are here to be a resource to you as you really advance policy systems and environmental changes to address and reduce cancer risks and cancer disparities. So I am Shanta Chambers, and on behalf of my fellow networks, Geographic Health Equity Alliance, Nutrivoces Adelante, I thank you for your time today, and be on the lookout for that follow-up email with the meeting summary, the evaluation, which will also be coming to you, as well as just some information about our future offerings. If you have your phone handy, take a moment, scan that QR code on your screen again, and complete that evaluation because your feedback is critically important and helps to inform all future programming. Again, thank you for your time today and enjoy the rest of your day.